Welcome everyone to the fourth webinar in WALGA's Local Government Public Health Planning series. I'm really grateful for all the return participants and welcome anyone who might not have attended our previous webinars, but I will include a link in our chat very soon. And you can go back and watch previous webinars that we've done to date on the development of local government public health plans. Before we get going, I'd just like to acknowledge that I'm joining you from the land of the Whadjuk people of the Noongar Nation. I'd like to pay my respects to elders past and present and all the amazing Noongar people that are out there supporting local governments today to really empower and support particularly Aboriginal community controlled organisations in this space. So big shout out to you, and I'd like to extend that respect to the traditional owners of the land in which you're joining from and any Aboriginal people that might be on the webinar today. So far in the webinar series, we've really been focused on the earlier phases of developing a local government public health plan. We've looked at the pre-planning phase, data sources, how to use that data and your community engagement and consultation as evidence to shape and narrow down into your local priorities and actions that you might build into an action plan. And so today I'm really excited to have along organisations that can support you in the delivery of your plan. So that might be through grant funding or ready to use health promotion campaigns and policy tools that can be easily adapted to your local government. They can be co-branded. You can reach out to these organisations for guidance and support in implementation. And of course, we've just got a select few today, but I'm very grateful to Healthway, Lotterywest and the Cancer Council WA for joining us today as three very prominent organisations that work with local governments in all different contexts, not just the public health planning context. Many of you may be familiar with their grant programs and other tools and even be successful recipients of grants already for community events and other projects that your local government has been delivering. Today, we're going to look at how you might draw on their resources and supports and programs for both the development and the delivery of your local public health plan. As you go back through the webinar series to the recordings on our website, you'll also hear other organisations like Injury Matters has some grant funding and some ready-made programs that are easily adaptable to your local government. So again, we're not doing an exhaustive sweep today, but really just giving a chance for our friends at Healthway and Lotterywest and Cancer Council to kind of bring to life and give examples of how their programs have been supporting local governments to date. So we're going to start with Healthway, and today we welcome Joanne Graham-Smith, Senior Manager, Projects and Strategy, and Teppy McLaughlin, Health Promotion Policy Lead. And they're going to cover off on the specific supports for local government that they have available for public health planning. We're then going to move on and welcome Grant True, Senior Manager of Grants Development at Lotterywest. And then Emma Groves and Jolie Manfusas. I'm sorry, Jolie, if I've mispronounced your name, please correct me. But these two women are exceptional at delivering and bringing to life, translating research into practice with local governments. So we'll hear a little bit about what Cancer Council WA has to offer across their organisation and some of the specific work that Emma and Jolly are doing at the moment. As always, please put your questions in the chat and I can facilitate those to be asked at an appropriate time throughout. If you've got a desperate question that you need to ask straight away, just let me know and we can pause and make time for that. So don't be shy. Please feed the questions through. We'd love to get your feedback and make this as useful as possible to your local government. Okay, so I'll hand over first of all to Jo and Tepi.
Thanks, Chris. Thank you. I'll just try and share our slides. I believe that should have come across. Yep,
that's great.
Awesome. Well, thanks for having us, Chris. And yeah, I'll kick us off and then Jo will do the second half of our presentation. We'd also like to acknowledge the traditional owners of the land that we're meeting on today. And we'd like to pay our respects to elders past, present and emerging too. So we're going to talk about two things. I'll talk first about a template that Healthway has developed, and then Jo will go on to talk about the funding support that we have available for local governments with their public health plans. So to kick us off, template for local government public health plans. So many on the call have been involved in reviewing and looking at this template, and we're excited to say that we're very close to being able to share the template for local government public health plans that we've been developing and leading on. But first, we wanted to give a bit of background as to why did we develop a template. So we're all aware that the deadline is fast approaching and that local governments are very busy. And so what we did was we did an audit to find out from the 137 local governments that we searched, just 1 in 3 have a current public health plan. So there's clearly a lot that needs to be done by 4th of June 2026. And we'd heard about the various challenges that local governments have been facing, the capacity, as I talked about before. But really, there's a lot of support out there, and it was about operationalizing some of that existing guidance into a template. And that template can then be used if a local government so chooses to help operationalize some of that existing guidance to develop their public health plan. The template is fully adaptable and is not mandatory to use by any means. It's more so as a useful resource for local governments if you would like to use it. And it really just helps, yeah, like I say, bring to life some of that existing guidance, highlight possible data opportunities, data sources from some of the research that we've supported is built into the template, and it gives ideas and tips and tricks throughout the template as to where to go to find things. We've worked with various organisations to develop the template. We're really grateful for their input over the time. We are, in the final stages of hopefully being able to share this template. We'll be launching it on the Healthway website, and we'll be doing some social media around that and making it available. We'll also share it with the health service providers if they so would like to share it out as well. But if local governments are looking for it, if you're watching this recording in a few weeks' time, you should be able to find it on the Healthway website. And it will be alongside on a page with our funding as well. So here is the draft of what it looks like at the moment. We have set it up as a template, so the usual contents pages and all of the different various sections that one may want to include in a public health plan. As I said, it is fully adaptable. We have on the front page there, please adapt this template to your local needs. We know that that's the purpose of local government public health plans, is to be specific. So this isn't about a cookie cutter approach. This is about giving the opportunity to give a kickstart to developing the plan, given that only 1 in 3 local governments have a public health plan in place at the moment, and that the legislation argues that we need it for June 2026 with all of our local governments. Here's a quick snapshot from the action plan part of the template. We're not going to go through the whole template today, just to really give you a bit of an idea as to what's involved. So here's objective 2, might be around prevent, which maps back to the public health plan, the state public health plan around prevent, and specific actions, what the expected outcomes are, measures, all of the usual stuff you'd expect to see in a action plan, but hopefully we've brought together and given some examples of what that might look like in the plan. What we've also done as an appendix is provide a menu of tangible actions. And this was really drawing on some of the existing guidance that was out there, but also a literature review that we'd done to inform this menu of tangible actions. So we know actually finding some things to build into the plan as to what can we do tangibly, what can we do practically to address some of the priorities of the plan. That's what we've tried to do. So we've really tried to be worded clearly, show how and who is responsible, and maybe a mix of actions from advocacy related actions to, you know, we will advocate to do X, Y, Z, to actually we will deliver and we will do. So there's a range of actions in that menu. It's a non-exhaustive list, but it does give some ideas and some examples of what could be done. I've put in a handful here just to illustrate, just to give an idea before I hand over to Joe to talk about our funding. So here's one, swapping free parking. This is really mapping back to physical activity and encouraging the use of walking and cycling by charging the right price for street parking and using that funding then to make a more welcoming environment in our town centres and on our streets. Upgrading of bus stops, and we link out to funding sources that allow to do that. Obviously, again, these are all physical activity related actions from the menu of tangible actions. We've got actions across mental health, across alcohol, across tobacco, and across healthy eating. There's always one that we forget, but we've got 5 priority health areas at Healthway. So our menu of tangible actions are mapped to those areas. Of course, some of the actions lap over from mental health to physical activity or healthy eating to mental health, but you'll see that the menu is structured around those 5 priority health areas. A couple more then. Here's one around urban design and how we can design our streets to encourage more walking and cycling. This one's around an advocacy related framing of an action rather than a we will do this action. So this is one opportunity to create streets that potentially shift from the left-hand side to the sliding figure there, help reimagine our streets through the use of modal filters. We've really, with some of the menu of tangible actions, is to bring to life what it could look like. And so here's what we might achieve by implementing some of those menu of tangible actions. Last couple then, just to give that flavour, I suppose, from the menu. This one's around perhaps doing an audit of informal sports spaces, and there's a 5-page checklist that's available that we link out to. So we're really trying to give ideas of actually how to do these actions as well and how they might map. Obviously not relevant for all local governments, perhaps, maybe more relevant, more of a priority for some. That's the benefit of local government public health plans. They are specific to the local government area and what the priorities are of that local government. So that's informal sport. And our final one would be around activating community, to community voice, community input. And here's one potential tool to do that, which would encourage community to say how they feel on the street as a way for the local government to collect data about how community uses and feels on your community streets. So that's 5 examples for physical activity. There's a whole menu of tangible actions, not just for physical activity, but for those other 4 health areas: alcohol, tobacco, healthy eating, and mental health. So that's a quick snapshot of the template, and I'll now hand over to Joe to talk about the funding that we have available.
Thanks, Teppy, and thanks, Chris, for having us along today. It is a shame that we were hoping to be able to launch, to sort of say that template is ready now and available, but we hope in the next week that will be the case. We're just waiting for the final design version to come back from our graphic designers. But what we thought that local governments would be particularly interested in is how can we turn some of our public health plans into action as well, and recognising that sometimes that requires a little bit of additional funding support. So we're just going to take you through what we can offer and what we have supported with other local governments in times. So we obviously have funding available to support the implementation of public health plans, and that's called our Public Health Activation Program, which you can find in our Healthy Communities funding stream on our website. That funding is available for local governments who already have a published public health plan. The proposals need to demonstrate alignment with the published plan. So again, it's really about bringing to life or operationalising some of those actions that are included in the public health plan. As we would expect in the development of a plan anyway, these need to be designed with the community or the target group that they have in mind as well, and built on quality partnerships. So for example, with local health service providers, and you will see that in some of the examples that I provide shortly, but equally that might be with other of any of our other excellent community organisations working in this space, like in injury matters like Cancer Council and others. The value of the grants is open. It really varies depending on what the project is that you want to implement. So we really encourage you to sort of have that conversation with us. And it's probably important to note that funding is available for discrete projects that sit outside your BAU. So, and that's the case with any of the funding that we provide to organisations as well. It's not for your core operations, but it's for those additional kind of value add elements. And as always, we always encourage you to discuss your ideas with us prior to actually developing a proposal so that we can help guide you through that process as well. So some examples of what we have supported in more recent times. So the City of Rockingham was a really good example. This was actually through our Healthy Venues funding stream, but it was very much built around the premise of supporting local government public health plans. We provided a grant to support the healthy food and drink provision at 3 venues across the City of Rockingham. So the Aqua Jetty, the Rockingham Aquatic Centre and the Mike Barnett Sports Complex. And the major objectives of those were really to increase the promotion and availability of healthy food and drink options, while at the same time removing the marketing and promotion of unhealthy food and drinks. So you can see a couple of before and after pictures there of sort of what that looked like before our funding, you know, seeing some of those cafe barriers with ice creams and other unhealthy items promoted, and then that really nice, clean kind of environment that we've been able to create as a result of the funding. And this has allowed the City of Rockingham, so if you're a resident in the City of Rockingham, if you're going into any one of those venues, you're met with a really similar clean environment, and you know that you can, you can access healthier food and drink options at those venues as well. We did do an evaluation of that, which showed that certainly the availability of healthy food and drinks on these canteen menus went up. The promotion of unhealthy food and drinks went down, and most importantly, there did not seem to be any impact on the sort of overall bottom line of what was what local governments were able to sell. So that example is, I think there is also a bit of a showcase of that on our website if you would like more information. Another one that we supported was to the City of Vincent, a grant of just under $125,000 to implement their smoke-free town centres project. So this was looking at adopting a local planning policy to restrict the opening of new businesses whose primary aim was to sell tobacco products and smoking-related devices, installing smoke-free signage, and really undertaking that kind of relationship management with businesses. And what came out of that was essentially smoke-free town centres in 5 key locations across the city of Vincent. Once again, that funding included a really robust evaluation that the city undertook with the help of the North Metropolitan Health Service, and has certainly shown a reduction in the observations in people smoking and vaping in those town centres, and also in terms of cigarette butts as well. And the final one we just wanted to show was to the Shire of Waroona. Quite a small grant, very modest investment to implement the Waroona Railside Park project, and that was again around promoting that facility as smoke and vape free, and that was aligned to an action in their local public health plan. And yeah, that's been really exciting. And again, once again, that local shire worked with the South Metropolitan Health Service in the implementation of that. So those are just a few examples. We're very, very keen to help support local governments, not only in through the provision of the template in developing their local public health plan, but also in bringing those plans to life as well. So I guess what I've said to a number of local governments so far is, not to be constrained by in your thought around what you might put into your local public health plan. Really think about, remember that Healthway is there, that you can include some actions in there that might be dependent on some funding, and we're really keen to have those conversations with you. So Tippy and I are available to have that. Our website is there for more information, and really happy to take any questions at any stage.
Thanks so much, Jo and Tippy. I know we're looking forward to having a look at the template and seeing all the ideas and tangible actions menu to see what's available and how that would work. So we'll keep our eye out for that one. I think it's really vital what you were just saying there, Jo, about the way in which local governments can ask for help through their health service providers, and thinking through about not just, how to frame up a grant application to Healthway or even Lotterywest, but what role they might play in the evaluation process. I think that's something that I hadn't thought of before. So that's great advice, and really useful to think about reaching out to successful grant recipients to ask how they might have gone about that, and reach out across the sector to your peers and test how that'll work together. I think for local governments, particularly small country local governments like Waroona, they probably couldn't have, some of those actions might not have been feasible just on their own. So that partnership and support is such a crucial factor here. So thank you so much. Okay. I keep looking at that sliding animation and
we'll stop sharing.
I'm dazzled by it. And yeah, it looks great. I'm sure some local councils might need some consultation on getting rid of all those roads and parking, but that's all part of the fun of local public health planning. So that's all good. We're going to throw now to Grant True. Grant, are you there?
Yes, hello.
Fantastic. Thanks, Grant. I'll hand over to you. I just have a question from Leah, just asking if you might be open to sharing the slides after the webinar today. So I'll leave that with our presenters. They can have a think about it. All good? Great.
Very good. Okay, so just checking everyone can see the Lotterywest grant making slide. Is that screen?
Looks good, yep.
Great, thank you. So thanks very much for the opportunity to come and have a chat with everyone. A lot of local governments have already obviously tapped into Lotterywest for funding. So some of this may be old news to some people, but I'll run through it just as a bit of a reminder about where Lotterywest sits in its grant making, particularly for local governments. So the good news is we've been having a bit of a look at how we work with local governments, and the last 3 years of Lotterywest funding, we've allocated $82 million out to 81 local governments through 181 requests. So that shows us that we've got pretty good engagement with the local government sector. So again, like I said, a lot of this will be a little bit old news for some of you, but it is a good chance just to refresh how we work with local governments. So, so about Lotterywest, established in 1932, and we're the only state-owned lottery in Australia, which means all profits are returned to the community through prizes or grants. So we don't receive an annual allocation from Treasury. We pay our staff, we run our campaigns, we deliver funding and prizes out to the community from all of our sales. So it provides us great flexibility in how we operate, and we have good working relationships with a number of state government departments. All of our grants are recommended by the board and then approved by the Minister for Lotterywest, which at the moment is the Premier. All of our funding for the community is all run through our community investment framework. So just a bit of a refresh on that. That's the Lotterywest and Healthway Community Investment Framework, or CIF. Lotterywest picks up the first 4. Healthway is that 5th one on the right. The main one that we work with local governments on is the first 2, inclusive, thriving communities and connected cultural experiences. A couple of things to think about when applying for a Lotterywest grant is who we can support. So good news for everyone here, all local governments in Western Australia are able to receive funding. We're also able to support not-for-profits, and that provides us great flexibility out into the community. We have very small not-for-profits applying, and then we have some of the big end-of-town not-for-profits applying for statewide programs into the multiple millions of dollars. So we're able to cover a wide cross-section of the community. What can we support? Ultimately, it needs to result in public benefit for the WA community and have outcomes that link to our CIF, or Community Investment Framework. What we don't support, now there's a couple of important things in here that are relevant for local governments. Obviously, WA local governments, first one won't be a problem. All the initiatives must be within WA. So we can fund East Coast organisations, but what they're delivering, what we fund, it must be delivered in WA, and funds can't be used for East Coast benefit. So we don't mind sharing resources and learnings, but the on-ground support must be for West Australian communities. We're not able to fund retrospective requests, religious activities, and general or competitive activities for sporting clubs or codes. So Lotterywest already provides an annual statutory allocation through the department for sport, and then similar for culture and arts, and then also a significant annual allocation to Department of Health. So we already provide those cohorts of the community funding via those different departments. Initiatives that are core business of other government agencies. So, for example, primary healthcare, that's a responsibility of state, federal government funding. We don't fund programs that operate in that primary health space. We also find it very challenging to support programs that are defunded by state or federal funding. We also look to always try and find a space where we're adding value. So that's probably quite relevant for a number of the potential programs through local governments, is we're always looking to add value rather than being the sole funder or the core funder. Not able to replace assets that have previously been funded by Lotterywest, or initiatives that are not considered affordable or accessible. I think I saw a question there about Cocos and Christmas. No, we don't fund those because that's all picked up through territory funding through the federal government. I think we may have funded them a number of years ago, but our current framework doesn't allow for that. We also don't look at funding for health and medical research and its translation or dissemination into the community. And we don't fund applications that don't reflect our good practice requirements. So those good practice requirements, there's 5 key areas. They're up on our website. So I won't go through them in detail. But look, the majority of local government programs that we look at well and truly align with that. So our grant limits, the minimum request is $3,000, maximum $15,000 for non-registered organisations, for GST non-registered, so that's obviously not local governments. There is no upper limit. However, grant requests should be reasonable and represent value for money. What else? Oh, and we're also when we're working with local governments and the not-for-profit sector, we make sure that our Lotterywest funding is as a complementary grant maker. So that means that we expect a co-contribution. We don't have set percentages. We work with each applicant to see what's reasonable for the program, for their own capacity, for their own organisational structures, and we can look at financial or in-kind contributions. Prepare your application. So again, a number of local governments are already familiar with our portal, but we have a new portal that came in about 2 years ago. Everything is done online, and that goes from application right through to payments and acquittals. It's all done online now. So it provides us really good visibility, and it allows us to work really strongly as a developmental funder, which I'll go over in a second. So the grant making process, we ask all applicants to consider a 4-month turnaround. The good news is we work developmentally with all of our organisations. So that means once the application is in and submitted, one of our team will be in touch to have a chat. Quite often organisations will get in contact with us prior to application, which is fine. The reason that's beneficial is we're able to work with the organisation to strengthen their application. We're quite open to having discussions with applicants to provide some early advice that it may be a challenging request, that components may not be eligible, that components may not be as strong as other components, rather than just submitting an application and not hearing from us for 4, 5, 6 months and then receiving an email. We'll work with the organisations all the way through, and that's right up to the assessment deadline. Even as we're submitting to the board, quite often we'll be having final conversations with the applicant. Once the application is reviewed and hopefully approved by the minister, then we continue to work through the online portal for payments, any variations, reporting, and acquittals. Our application portal is designed, and the questions are designed, and the language is designed that for very small organisations to be able to complete. We do get some requests in with the support of grant makers or commercial grant writers, but generally most applications don't need that additional support. It's a fairly self-explanatory process with 4 key questions. What we look for, so we're always making sure that it connects to the community investment framework. We're looking for the proposal to respond to an identified need or opportunity within the community. So we would always look to see what research is being done, what consultation is being done. And again, local governments are fairly good at this component, given that there's a lot of planning for your sector and a lot of consultation, particularly for large requests. through your council and other relevant stakeholders within the community. We like to see an appropriate and realistic budget and value for money. So we don't like to fund for failure. So we don't want things to be done super cheap. Likewise, we also need to understand that there is a value for money component and consideration when we're looking at program costs, event costs, entertainment at events and things like that. We also like to look at the organisational capacity to deliver the program, and really just to understand, again, not necessarily for local governments, but for some small not-for-profits, we don't want to set them up for failure. So we want to just make sure that they're able to deliver what they're requesting. Community Impact Hub. So a lot of you would have seen this already. It's a fantastic tool. We find that organisations are using this not just when requesting Lotterywest funds, but for some of their own planning, some of their own requests through other organisations, whether that's philanthropic groups, federal, state level funding organisations. It provides a really good avenue for organisations to be able to run through and highlight what the outcomes are that their requests. It also allows them to highlight what's needed for their requests, some other partners, potential risks, and some other key considerations. Just let that person in. What else have we got there? Oh, there's really importantly, there's also a whole bunch of other tools on there and data, and also a number of other really good examples of programs and things that Lotterywest has funded. So if you go on and have a look at that hub, you've got a bit of an idea, you'll be able to run through that hub about seeing what else has been funded in that space to get some other good ideas, other examples of really good requests, and then you'll be able to work through the Impact Hub to understand what is needed for your request. The good news is any work that's done through that hub, you're able to then cut and paste and use that for your Lotterywest request. In regards to some of the crossover between the health plans and Lotterywest funding, I mentioned before the $82 million in requests that we have approved. The majority of those are events and projects or infrastructure and construction. So we fund a lot of play spaces, a lot of play areas, skate parks, things like that. We also fund community organisations to fit out facilities, their own buildings. We also do a lot of events. So these are a great way for the community to connect. And we see events ranging from to a couple of $100,000 right down to $3,000 requests. The main thing we're looking at for events is that they are for the whole community, not just one section or cohort of the community, and that they're free or financially accessible. So if there is an entry fee, it needs to be minimal, and to make sure that those events are accessible for the whole community. That's it for me. I'm happy to, well, there's some contact details there. We have a pretty good support system. So you can either call 133 777 or email grants@lotterywest.wa.gov.au, and that will get through to the relevant team or assessor. So that's the one point of contact, and then they'll make sure that you get through to the right place. That's it for me.
Great. Thanks so much, Gran. I think it is one of the biggest transformations that we're seeing in the grant making space over the last 10 years is that developmental grant making, isn't it? Where, you know, it's no longer a process where you're flying blind, writing your application, waiting months for a response, and then having a sorry, not successful email at the end of that process. And it sounds like from Joe and Teppy that Healthway also is very keen to work iteratively with applicants, people wanting to apply for money to test whether it's eligible, supportable, likely to succeed and likely to fit within the eligibility criteria. So do reach out early if you are interested in understanding the process, but also whether you want to just, you know, test some ideas and early thinking, and whether these organisations might be a good avenue for funding to support. We had a question from Lara. Can health service providers look at information on the Community Impact Hub grant? Lara, I'm not sure whether you mean can they get in and use the hub themselves, or can they get in and look at information that you are inputting? Maybe you could jump on if you'd like to and just clarify that question.
Hi there. Thanks so much. Great presentation, Grant. Really enjoyed that. And also the Healthway presentation was excellent. I just was curious about the Community Impact Hub and whether, as a health service provider, we can look at some of the case studies and projects that have been funded or supported in specific local government areas. Are we able to kind of take a look at that? Or
no, only if they're up there as examples. So we don't have stats on the hub about which local governments have got funding for, or you know, any stats. All of our approved requests are available on our website. We report them like a lot of other funders do. So you are able to go through and see what's been funded in your local government area from other community partners. But no, I don't think that's able to be searched or, filtered and things like that.
Okay, great. Thank you.
Fantastic. Brett, I was also just, when you were talking, thinking about that need to provide evidence of any research and community engagement to demonstrate the need for the funding or the project. And I was just thinking this is where your public health plans might come in handy, because through the development phase of your local public health plan, you might be collecting that evidence and that data around the need to address a particular risk factor in your community, or, make some particular programs or facilities or infrastructure or whatever accessible more broadly to all in the community, not just a particular cohort, or make it perhaps more affordable or something like that. Does that ring true for you, Grant?
Yeah, so we, regardless of the applicant, we always try and encourage the applicants not to go out and create new documents just for us. If there's existing planning, if there's existing documents that you can use, we're more than happy for you to cut and paste and use those and attach as many documents as you want. We'll come back and ask for more information or clarification if we need. But yeah, particularly smaller organisations, we don't want them going out and creating plans and alternative documents if they've already got something that can be used in part. So yeah, so any of the public health plans, any of the research or consultation that's done for that is definitely of use.
Fantastic. We love hearing how we can consolidate and streamline some of that workload for people, particularly in smaller local governments without the workforce. So thank you very much. That's great. If there are no other questions for Grant, we'll move on to Cancer Council WA. We've got Emma Groves with us today, who is the Food Policy Senior Coordinator for Cancer Council WA, and Jolie Manzifas. Have I got that right, Jolie? Thank you so much. I've been working on it. Alcohol Policy and Research Coordinator. So correct me if I'm wrong, because I've taken the last 6 months to really wrap my head around this, but Jolie and Emma have complementary kind of work streams and research projects around looking at the impact and how to reduce alcohol and junk food advertising particularly working with local governments on some of these issues. So some of you may already be engaged with these amazing women on some of their research projects and translation projects. I know I have been literally sitting at my kitchen table and tearing out articles in my local newspaper that talk about the success of some of Emma's work in particular around bus shelter advertising. So some of you might like to get on the website and just explore some of the very diverse projects that Cancer Council is doing in this space. But they're representing the whole of Cancer Council WA today and going to be talking more broadly about very tailored and customised resources that can be easily adapted to your local setting and support you in the delivery of some of your work across a broad range of areas. So I'll hand over to you now. Thanks.
Thank you. Thanks for that really wonderful introduction. Very complimentary. Thank you. So yeah, it's great to be here today and to co-present with Jolie. So just before we start, Cancer Council and myself really do want to also acknowledge the traditional owners of the land that we meet on today and throughout Western Australia, and to pay our respects to the traditional custodians of country throughout WA and recognise their continuing connection to land, waters, sky and community. And also we pay our respect to their elders and extend that respect to all Aboriginal peoples living and working in this area. I'm just going to minimise my screen so I can't see anyone. And for some reason, here we go, it has clicked through. Fantastic. So very briefly, we are representing all of Cancer Council today, but particularly the prevention and advocacy side of Cancer Council. So our vision is a cancer-free future for Western Australia. And we really do start that with looking at prevention, how we prevent cancer, how we can make sure people are accessing screening programs and being diagnosed as early as possible, but then also reducing the impact of people that are living with cancer and their family and their friends and their community. But as I said, today is all about those first two pillars of what we do. And it's about cancer prevention for looking at local government's public health plans. And I know there's been other webinars previously up to now around what might be the risk factors, priority risk factors for local governments to implement within their public health plans or as part of their work. And I suppose the good news is that the risk factors for cancer prevention are the same as the other chronic diseases within Western Australia, which might be priorities for your local government. And they are tobacco use, poor diets, alcohol use, UV exposure and physical activity, inadequate physical activity levels. And we're here because cancer as a disease burden as a disease group does contribute the highest burden of disease in Australia, but we really try and focus on that 36% of disease that is preventable in Australia by reducing our exposure to these following risk factors. So as Cancer Council, we do have a team so aligned to each of those risk factors here on the screen. We have a tobacco team, we have a food and movement team, which is where I'm coming from. Jolie is on the alcohol programs team. We have a Sun Smart team, but supporting that, we also have an Aboriginal projects team. We have research teams, legal policy advisors, and we also have regional cancer prevention coordinators, and there's a few online today. So in some of the regions, there are Cancer Council staff that you can reach out to and talk about some of our prevention and screening programs. And just to mention as well that we really encourage people, we are not be all and end all, obviously. So this presentation will follow on really nicely from Tepe's presentation, the template that he's developing. And we also really work closely with the area health services and making sure that they are that sort of one of those primary contacts for local governments as well, to be able to really inform that public health planning process. So today we're really just going to focus on a few of the main streams of support that we provide. And again, this is really following on from Tepe's. He sort of mentioned, is there sort of a policy environmental aspect to what you're doing as a local government, but then also what can be that sort of program delivery and partnership type aspect of the public health implementation of that plan. So we've separated this into those 3 components. What are some policies you can implement to reduce the impact of those risk factors to community? What are some of the partnerships that you can deliver in partnership with Cancer Council? And what are some of the tools and templates that we have? And the main thing is if you wanted to scan this QR code or come back to the presentation, but this is our main guide on the screen. It's our guide for local government's public health and cancer prevention. It's separated into each of those risk factors, and it includes a whole range of strategies that you can implement as part of your public health plan or as part of your work in improving the health and wellbeing of your community. And we'll keep coming back to this slide as the main tool that we have that sort of centres all the work that we do. So firstly, just around policies, and you'll see that, you know, both Jolie and I have policy and our position titles. So the reason why they are so important, what we focus on is, you know, it's really setting the foundation for people to be able to have those healthy behaviours. So, you know, we're more likely to be able to walk and cycle in their safe and connected streets. We're more likely to be protected from UV exposure when there's adequate shade. We're more likely to, you know, eat well and make a healthy choice when there's healthy options available. And so healthy options are the available, accessible, affordable, and most promoted. So it's really when we are recommending strategies to go into your public health plan, we really like to have them some sort of, I guess, policy or environmental component to those strategies, as well as the program delivery or the educational perhaps component to that strategy. So these are some examples of policies that are specific to each of the risk factors. So the smoke-free public places has already been mentioned, which is great from Joe. So the Make Smoking History website, which will be linked from the Cancer Council website, has a list of what are all the laws in Western Australia around smoke-free places, but also has examples of local governments who have created their own bylaws to create even more smoke-free public places. And this is really important. It's going to protect people from secondhand smoke, but also really just, you know, changes the social and cultural norms around smoking, and there's less places where people can see people smoking and be impacted by that. If we go around clockwise, you can see that their children see these ads, and that's around what advertising is on your local government assets. So there are some local governments who have looked at implementing policies to ensure that some of the most unhealthy advertising, so advertising for really highly processed foods and alcohol, is restricted off local government assets such as bus stops and bench seats and bins, for example. And all of these policies are listed in that overall guide as well. On the right is a community event. So it's about looking at, you know, local government events, or for example, Joe's presentation, it was the Sport and Rec Centre. What events or community places, how can we support people to eat well and avoid alcohol in those places? So can the event have a healthy food and drink promotion policy and alcohol-free policy? Can the Sport and Rec Centre have a healthy food and drink policy, so that there's a lot more healthy options and not advertised the unhealthy options? And going around, then we have a beautiful public open space that's well shaded. So looking at is there policies around when we're developing new public open spaces for adequate shade, and that they're easily accessible by active travel, so that people are more likely to walk and cycle? Is there water fountains there, for example? And then it's also looking at, you know, broader than the public health plan. We don't expect the public health plan to be able to do absolutely everything. So how can we embed some of these strategies among other different types of work that the local government is doing? So for example, can access to water fountains be part of, you know, public open space strategies? Is there, if we go above that, there's an image there of fast food outlet, you know, with people walking past in a school bus. Is there some ability to have a local planning policy around drive-through fast food outlets and where they're allowed to be located? Is there some really high-level public health priorities as part of the planning scheme and strategies? Another QR code here is directs links directly, apologies, to the SunSmart page for local governments. And it's around, well, how can we look at shade strategies that are outside of the public health plan remit? So can having more shade be part of our climate change and heat mitigation strategies, or can it be part of our tree retention and canopy strategies? Is it about having beautiful, attractive public places that people want to go to and spend time? And it's also remembering that, you know, local governments might have a really large workforce that are working outside, so making sure that part of their workforce policies is protecting those workers from UV radiation. So what we do in terms of supporting local governments for developing these healthy policies, again, back to the guide, there's lots of different case studies and examples in that. We're very happy to provide input into your local government draft plans or whatever submissions that are required of Cairns Council as a organisation that supports the draft public health plan, for example, or attending any workshops when you're drafting or developing the plan. We also can provide a little bit of advocacy and support. So if you do have one of these policies that you're trying to draft, we can certainly assist with the drafting of it and trying to gain support as it goes through administration and through council. We have previously provided deputations before when some of these policies are being reviewed by council. And we also have some case studies. So as well as what's in the guide, we might have some case studies for each different risk factor in their policies. So for example, we do have a list of case studies of local governments that have introduced some local healthy advertising policies. We don't have that on the website, but you're absolutely more than welcome to reach out and we can chat and share it privately with you. So hopefully that's a very brief overview of why policies are important for each of those different risk factors. And now we'll move on to some of the partnerships and delivery that we can help out with. So Cancer Council runs the Live Lighter program. So it's a mass media campaign to encourage West Australians to eat well and be physically active. And Jenny Atkins, our senior stakeholder coordinator, works really closely with lots of local governments to try and extend that campaign out locally. So these are a couple of examples where we have co-branded recipe books or other merchandise. We've developed some exercise videos and had them on QR codes on outdoor exercise equipment or just a park bench, encouraging people to be physically active. And there's a whole range of different assets that local governments are very welcome to use, such as outdoor advertising, social media, tiles, and more than happy to co-brand and really work with you about how we can promote the Live Lighter campaign and its messages on your local community. And now I'm going to pass over to Jolie.
Thanks, Em. We will still be co-presenting because Emma's going to control the slides for me. So we also have SunSmart as part of our division, and they have brand guidelines and a sub-license agreement for use by local governments, free licensing as it shows you there. So the brand guidelines are pretty important. They make sure that the logo and the icons are used correctly so that the messaging is always consistent and recognisable. But the licensing gives you permission to use the logo and icons, and you gain access to that by signing up. That makes it easier to deliver this kind of clear and effective SunSmart messaging, but it still protects the brand. And the photo there is an example of how that has been used by a particular local government who are featuring quite heavily in our presentation, I've realised, and that's been drafted in that's been highlighted in their draft public health plan. Thanks, Em. The next thing I wanted to talk about is our particular team, the alcohol team. Cancer Council WA are the non-government partner on the Alcohol Think Again campaign, which is run by the Mental Health Commission. So the QR code there will link you directly to the Alcohol Think Again website, and there's loads of free downloadable resources there that you can use to extend the campaign into the community while, like, for example, using them on your socials or at events. Something you might like to think about is that the photo in the middle is some local governments within their bus shelter advertising contracts have a free allocation that they're able to use however they like to. And there might be other opportunities for advertising within the community. And you could potentially think about extending one of the campaigns that we've talked about. So partnering with Alcohol Think Again, or partnering with Live Lighter or SunSmart to help deliver that message into the community. And lastly, from alcohol, there's one more thing, sorry, to this one, leave it there, is just to involve us if you have local action groups, local drug action groups or teams, which are community-led collaborations that are working together to prevent and reduce the harmful effects of alcohol and other drugs in the community. We sit on a few of those kind of groups, so we'd be open to chatting about that. So the last kind of section that we wanted to give you was really just a very brief walk through what is actually within the guide and what you could expect to see there, and the kind of tools and templates that are available to you. If we can have a look at the next one. Thanks, Em. So we have already talked through the guide a bit, but there are some really specific inclusions that we wanted to highlight. There are, as Emma mentioned, some examples of local government policies or local laws that you can use as a template or model. Sometimes there is the specific wording is within the guide. Sometimes it's linked out to the other local governments. But some of those that we cover are things like sun protection policies, healthy food and drink policies, planning policy inclusions to encourage active transport, smoke-free outdoor areas or community events, and workplace policies. As Emma mentioned, that many local governments have quite a large workforce, so actually having those internal policies is sometimes just as important as protecting the community. Within the guide, there are also links to other external programs, such as the Fuel to Go and Play program and Healthy Active by Design, which can be used by local governments to create healthier environments in their communities. So what we've tried to do with this guide is kind of make it not a one-stop, but a pretty good starting point for any of your priorities that you want to address. A supplement that we have to the guide is the document in the middle there, which is we call the toolkit. It's the toolkit for healthy advertising standards, and that contains practical steps and templates and some case studies that reduce healthy advertising exposure in the community. So there's loads of information in the toolkit, but we recommend that you reach out to us if you're considering this approach so that we can work with you. We also have a specific template that again is not on the website, but are very happy to share that with you. That's the third document there. It's a template or a protocol to support you in building some of the local evidence that will help you understand what's happening in your community and work towards some of these initiatives. So this one outlines how you, or even local sporting clubs or other organisations, can audit the shade, advertising and sponsorship at sporting reserves, but it could also be adapted to any of the community or local government infrastructure, and give some tips on how you can support health promoting organisations and venues. Thanks, Emma. The SunSmart team also offers some really practical advice and expertise. They can give guidance on programs and initiatives that protect outdoor workers and the community, and encourage UV protection in the community. They have free resources such as posters, banners and digital materials that promote sun safety. The team can offer tailored talks for staff, contractors or community groups on UV risks and protection. And there are some collaborative educational modules with WorkSafe WA, which is specific to outdoor workers. They also can provide some advice and support on providing shade and sun protection at public spaces, parks and events. So there's loads of information again on the SunSmart website, which can be linked from the Cancer Council website or directly from that QR code. Thanks, Emma. And then make smoking history. Again, there is a QR code there, but you can find Make Smoking History's page within the Cancer Council webpage. And they have smoke-free and vape-free signage templates that are available for use by any local government. And again, if you follow the QR code there, they can work with you to customise these for your location. So they replace the image with your location name. So it won't say Town of Quokka, it will say your local government. Also on that website, there are some policy templates that are available for community service organisations within the local government, but they can also be adapted for use for your actual local government to use. Thanks, Emma. And then in summary, we just wanted to show you how to find the resources and tools that we've talked about. So the website that I've said several times without telling you what it is cancerwa.asn.au, and that obviously covers the whole range of the Cancer Council WA activities. So please feel free to explore a little and see what else we do. But with respect to what we've talked about today, from that website, you're best to navigate to Policy and Advocacy tab, and then to Local Government Policies and Prevention, or the QR code there will take you straight there. On that page, you'll find several subheadings, including creating healthy advertising standards, which is the toolkit that we talked about, providing health promoting sporting reserves, which the protocol that we talked to, and supporting your community to reduce their risk of bowel cancer, which is an opportunity for local governments to work with Cancer Council WA again to improve screening rates and lower the incidence of bowel cancer. So also on this page, under the heading Developing a Local Government Public Health Plan, is the guide that we keep banging on about. So as this is so important and useful, I've included the QR code once again to take you directly to that, but please don't ignore what else we have to offer. This is an opportunity time to remind you of the regional supports that we have available. So we have dedicated regional cancer prevention coordinators. And again, as Emma mentioned, thanks to those of you online, and they can work with each of our teams. So they're very diverse in their approach, but they can work directly with each of our teams and the local services. So a lot of their focus is on improving screening in their region through the Find Cancer Early program, but they're able to offer other supports. And for those of you in regional locations, they're a great point of contact. So in summary, at Cancer Council WA, we have a range of supports that can help you in creating your public health plan, and particularly to help you address specific risk factors that are related to cancer, but also those other preventable diseases, implementing actions from your public health plan, and providing advocacy and support to introduce policies and local laws that really will support that plan. That's it from us. Please feel free to reach out to Emma or myself, or to the generic email address that we have there. Thank you.
Thank you, Emma and Jolie. That is just such a wealth of information, and I'm confident that you have definitely introduced people to things that they hadn't been aware of before today. It's been a steep learning curve for me as to the range of work that Cancer Council WA does. But when you also turn your mind to the state public health plan overarching objectives, but also the priorities across the state plan, you can see how your work aligns to mental health insofar as, making, active living, more pleasant and safe for all the community through shaded sporting and recreation sort of public spaces, and even how it might cross over into reducing the health impacts of climate change. These are all priorities in the state public health plan And so you're getting huge bang for your buck and your time and your resources if you're tackling these things. You're actually hitting a number of priorities across the state public health plan. So I really encourage you to look at this as excellent ways to prevent cancer prevalence in your community, but you've also got opportunities to hit a whole lot of other targets there. So thank you so much. And also just, I think the value in model policies that can save local government officers a lot of time and also just provide inspiration. You're not starting with a blank piece of paper when you're sitting down to draft up a policy that you know has a long approval pathway through council. You've got examples of what's worked in other local government settings. You might be able to connect through Cancer Council to officers in other local governments that have had success and might be able to share some lessons learned through the approval process. But also hopefully you can look at these resources, and when you're sort of narrowing down to find, to think through what to include in your action plan, hopefully some of these resources give you inspiration and ideas of what actions you might include, because you can see they're ready-made and sitting there waiting for you to whack your logo on and put on your Facebook page along with your, monthly community newsletter, for example. So the health promotion actions are so well supported by these organisations. I really encourage you to explore their website in detail. Have we got any questions from anyone or comments, or even some examples that people might like to share of work they've done in their own local government around this health promotion space? Or any of the health service providers on the line? I think Asunta and others, Colby is online. If any of the health service providers want to jump in and just add their own sort of perspectives on this work, that would be great.
Hi, Christina, it's Colby.
Hi, Colby.
Hi. Yeah, I was just going to say, I, from a HSP point of view, really value the work, especially with Cancer Council. I think what works well is we each have a different role and a scope of work that we can do. So it's really helpful for us when we can link in with Cancer Council, particularly on advocacy issues, and work together in partnership with the local governments.
Fantastic. So Colby, you're from East Metro Health Service. So are you finding as well that people can draw inspiration from neighbouring local governments that might have had some success with a campaign and then build on that at a regional sort of level in your area?
Yeah, definitely. Like recently, Karis and our team worked with 3 local governments together. So Belmont, Charlie's online, and Jamie Lee from Vic Park, and also South Perth to work on a project with the clearly air vaping decals just in hotspots where youth are. So I think that it's great when we can pull resources together, and we're also looking at a similar project with City of Swan at the moment as well.
Sensational. Thank you. Asunta, did you want to jump in?
Yes, thank you so much. It was a great presentation today. Thank you. One of the things, it was interesting because one of our local governments has reached out to us, and they really want to do something around transport and making sure that people are really walking to work. And one of the conversations that I had with him was, let's see if we can link to Department of Transport, Perth, and also Live Lighter, because I know that there are some local governments that have got QR codes in strategic locations where they can then, like if they're sitting down on a bench, and it might then have some information linked to Live Lighter. So it was really interesting hearing Live Lighter present or hear Cancer Council present today, and echoing what Colby has said, it's really great having these organisations that we can then facilitate those links to. So I'm thinking about facilitating links to Department of Transport and Live Lighter, and seeing what we might be able to determine in that particular local government where they've identified that they really want to increase their physical activity levels. So that's one of the things that's happening just with one of our local governments. But certainly, yes, we're having lots of different local governments coming to us and asking us for some information, and where that, and we are looking at the strategies, and I'll be very interested in looking at the template as well that Healthway have mentioned as well today as also. So yeah, there's lots of things happening, but really appreciate the work that Cancer Council are doing, and really keen to facilitate those links.
Thanks, Asunta. And I should have mentioned that Asunta is from the North Metro Health Service.
Sorry, yes.
I just assume that everybody knows everybody now, because it feels like we've shaped up a bit of a family over the last 6 months or so. And I'm just loving the way that there's lots of cross-pollination of ideas across the organisations. And hopefully people are feeling supported in this way, that there's lots of different strands to the public health planning space and the delivery of projects and programs. But hope there's a well networked local government sort of network around this work. So it's great to see that connectivity. I think as well, just remember that different areas of your local government may be looking at urban greening or a climate change adaptation strategy. Those might already have done some consultation around greening projects in your local government. I know WALGA has a team that is developing quite a lot of advocacy around active transport and working alongside the roads teams in that space. So you might be trying to achieve a public health outcome, but remember to draw on other teams in your local government administration that might be tackling this from, say, an infrastructure perspective or a planning perspective or an environment perspective. It's always good to share the load and spread it across your organisation as much as you can. Okay, I think that might be. Has anyone got any other questions? Just a reminder that links to Healthway and Lotterywest can be found on the Department of Health's Public Planning for Local Governments webpage, and they have an abundance of different fact sheets and resources that can back up what we've discussed today, and make sure you visit there for further guidance and direction. But I think that might be enough for today. It's a great gathering. Thank you. We've got our next webinar coming up in a couple of weeks, which will look at mental health and wellbeing. So as discussed, many of the health promotion work today is great for cutting across mental health and wellbeing strategies, also avoiding getting people active and engaged in their community. So we'll be looking forward to having diverse perspectives from people from organisations like Act, Belong, Commit program, doing the prevention and promotion of good mental health, right through to people working in the more acute areas to talk about ways that local governments might like to partner on mental health first aid training and supporting their workforce around trauma-informed strategies for community-facing staff in their local government. So I'm really looking forward to that one. We'll also have the Mental Health Commissioner along. I'm sure they will talk a little bit more about the Alcohol Think Again program and some of the campaigns that they have available or that they own, but can be adapted and shared and scaled across your local context. So please return to our website, click on the register now for that one. That's on the 23rd of September. And until then, good luck with all your planning process. Thanks for joining us today.